Welcome to the Branding Room Only podcast, where we share career stories, strategies, and lessons learned on how industry leaders and influencers have built their personal brands. Now, let's get started with the show. Y'all, on today's podcast, we have the remarkable Dr. Uché Blackstock, who for the longest time has been my friend in my head. Our discussion delves into so many things, but really what resonates for me is her integrity, the compassion she has, and the fact that she has this purpose-driven life. And we talk a lot about her book and her commitment to public health and equity. I can't wait for you to hear this fantastic conversation about how her experience from Brooklyn, like me, and in the medical field have led her to the work that she does now. Listen up. Hi, everybody. It's Paula Edgar, your host of Branding Room Only. Looking so forward to today's conversation with a phenom, Dr. Uché Blackstock. She is the author of the New York Times bestseller Legacy, A Black Physician Reckons with Racism in Medicine. In addition to being an author, Dr. Uché Blackstock is a physician and thought leader on bias and racism in healthcare. She is also the founder and CEO of Advancing Health Equity, and she appears regularly on MSNBC and NBC News. Dr. Blackstock received both her undergraduate and medical degrees from Harvard University, making her and her twin sister Oni the first Black mother-daughter legacies from Harvard Medical School. All the snaps to that. Dr. Blackstock, welcome to the Branding Room.
Thank you so much, Paula, for having me.
Awesome. So I'm excited for this conversation. I start off all of my podcasts with asking folks this question. What does a personal brand mean to you? How would you define it?
You know, it's so interesting when I saw that question. Well, when I saw that you had that question, I was like, oh my God, this is so funny that she asked me this, because recently at a talk, after I gave a talk, a journalist that I've been interviewed by multiple times over the last few years said to me, well, what are you going to do now? Because you are a brand. And what I recognize is what she meant is that, you know, all of the purpose-driven work I do is actually represented in me. It's who I am. I am authentic. I have integrity. I'm passionate. All of it aligns together. So I feel like when people, when they meet me, they're representing they meet all of the values that I hold very dear to myself and that are important to me. And that is my brand. That's what people know of me. That's why they respect me. That's why if I am sharing information, they listen a little bit, more because of those reasons.
Agreed. It's your street cred, right? Like it's the thing that you got, right? And that resonates for me because I followed you, as I was mentioning to you before we started, on social. So there are some core pieces that I know, right? And so it makes people feel as if they have an understanding of you prior to even engaging with you. And I feel even more so because I always say when I listen to an audiobook that you read to me a story out loud. So it's that and plus. So, okay. Thinking about that, how would you describe yourself in 3 words or short phrases?
Okay, 3 words. I would say, I already said this already, but I am compassionate. Mm-hmm. I am purpose-driven. Let's see, and I have, this is cheating, but I have integrity.
Mm-hmm. It's not cheating. It's all right. I think those all, if it resonates for you, it resonates for us.
Yes.
And obviously, it's hard to say 3 words when I know it's an unfair question, but I ask it to everyone anyway. So my next question is this. Do you have a favorite quote or mantra that you use?
Yeah, and I don't know who to attribute it to, but it goes like if your dreams do not scare you, that you're not dreaming big enough. Mm-hmm. And that's something that I didn't appreciate until more recently in my life. Mm-hmm. But, once I started thinking bigger, mm-hmm. giving myself permission to do so, and recognizing a lot of times when I was nervous about something, wasn't that I was nervous. It was just that I was heavily invested in it and I knew that I was going to do an amazing job.
Mm-hmm. It's kind of like when you think about those dreams, it's intention setting too. And when you have that intention, it's kind of like, it's outside now. So it's a little bit scary, but I get it, right? You all can trust in yourself. I have a magnet on my refrigerator that says, believe in you. And it's sort of exactly that, where if you can dream it, then it's something that's inside of you. other than me going to like space. But I'm not trying to do that. But yeah, I do think that we, society-wise, there's a lot of you can'ts. And when we start to own our cans, everything shifts. Everything shifts.
Right. Right. Agreed.
So tell me about this. Do you have a hype song? And here's how I describe it. If they're going to get full Dr. Uché Blackstock coming into the room, what song is playing in your head? Or if you're having a bad day, what song do you play to get yourself up? And it could be the same song or different ones.
So I was like, I grew up in Brooklyn in the 80s. Yeah. And, I love 90s hip hop. So I love the song Anti Up by M.O.P. Yes. It just is like the best. That's a song that I play like on my phone and my earphones, like right before I give a talk. Cause I'm like, Uché, you got this, right? It just like makes me feel I can do anything.
Yeah, no, that's a good song. So I'm putting together a playlist of everybody's answer, and that's a good one to be on there. And of course, my Brooklyn girl resonates with that because I'm like ready to dance. So yes, I love it. I love that. All right. Well, we started talking about Brooklyn. So tell me, my question is, how did you grow up, or where did you grow up, and how did that shape your personal brand?
Yeah, so I grew up in Crown Heights, Brooklyn. I actually spent all 18 years of my life on the same block in Crown Heights. Born to a father who was from Jamaica. My mother was from Brooklyn, and they were like the first in their families to finish college and then go to graduate school. So, I think that they wanted to provide us with a life, my sister and me, with the lives that they didn't have. So, we got to see the real on the streets of Brooklyn, in the 80s and 90s. I mean, we saw a lot. I saw a lot. Yeah. So I saw people get shot, I saw a lot of drug dealing happening, but I also saw a lot of joy. I saw my parents would take us to the Brooklyn Museum, Prospect Park, just like everything was a learning experience. And so I have very fond memories of growing up in Brooklyn. My mother was a physician. And so I feel like I was surrounded by Black women physicians growing up. So I knew that was something that I could be. And these were women that were also very committed to working in service to our community. So it was like the best role models I could have had.
Mm-hmm. Oh, I love that. Especially as I shared before. So your mom worked and you worked at Kings County, which is where I was born. And thinking about just Brooklyn, it's such a, I lived in East New York. I still live in Brooklyn, but I live in Clinton Hill now, a little closer to this side. But
we're neighbors.
Right. And so I always think about all of the things. Like I knew my precinct when I was growing up. Most people, when you're living in the suburbs, you don't know your precinct number. When you're not, you know it. But it didn't feel like a hard time. It didn't feel like terrible. It felt like this is just the Brooklyn that we're from. And I remember my mother used to take me to the library, to Grand Army Plaza. And I thought that was Manhattan. Because I was like, oh, this is big buildings. It must be Manhattan. And I didn't realize until I was a lot older that I was still in Brooklyn because we came all the way across just to go to the library. Right. A lot of fond memories in that space. And I understand as also my mother was Jamaican, and being raised by folks who have West Indian connections also shapes what is expected of you, don't you think, too?
Yeah, absolutely. A lot is expected. Yeah, a lot is expected.
So speaking of that expectation, tell me about your education journey then.
Yeah, so for the first part of my life, I went to a small Caribbean school, mostly Caribbean American school in Crown Heights called St. Mark's Day School. I was from pre-K to sixth grade. It was an Episcopalian school. Everyone, I felt like, it was like home. It was like home. And then after that, my parents, they wanted just to switch us out because they wanted us in a more academically rigorous environment. And that's when we went to Packer Collegiate, which is an independent school in Brooklyn Heights, totally just different environment. We were one of the only Black kids in our class, the only ones from our zip code, 11216. Most of the kids were, I thought my life was good, and my life was good. Yeah. But these other kids had lives that I could not have even imagined, lived in the biggest homes, went on luxury vacations. And I think that probably was the first time in a very long time that I didn't feel at home. I felt out of place. And then after that, I went to Stuyvesant for high school. So again, that's like a math and science high school, but only 5% of students are Black. So, kind of going to these being in a predominantly Black environment in elementary school to mostly predominantly white or predominantly white and Asian in high school, and being one of the only.
Yes. And then Harvard, darling.
Yeah. And then I just wanted to continue to torture myself. And no, and then Harvard undergrad, which is actually was pretty cool because I feel like I got to meet other Black students there that, also were really interested in a lot of the same things I was interested in, and made a lot of really wonderful friendships. But then, of course, during my sophomore year, my mother was diagnosed with acute myelogenous leukemia. And so that kind of made it, I feel like I didn't have the same college experience as my friends who were kind of just like having a good time, because my sister and I had to travel back and forth between Boston and New York City to see her. She was in and out of the hospital. And then we were also both pre-med. So we had to like take care of our work. It was a lot.
Yeah, no, when I got to that part of the story, I thought to myself how proud your mom must have been to have literally both of you as a legacy and going in the same path at the same institution. And the challenge, my daughter is a freshman. She just finished her freshman year at Spelman. And just thinking about college and the experience of having that first and second year where you're just like, woo, everything's great before you really have to focus. But when you're pre-med, I guess you really have to focus no matter what. And I can imagine how challenging that must have been, having to navigate your mother's illness, right? And at that time. So, my listeners know that my mother was killed on September 11th. And so when I thought about the things that aligned with us and having all of these similarities and then experiencing loss, losing your mother shifts to you, I think, in a way that people can't understand, because almost everything I do, I'm thinking, this is like I'm showing up because my mother would have wanted me to do. And I could feel that in what you were saying and the work that you continue to do and still do. And I really felt like this book was in honor of her, right? That you telling the story and the work that you have done. So before I jump into that, talk a little bit about the fact that you and your sister followed in your mom's footsteps going to Harvard. What was that like? Was she excited? Like, tell me what it was like when you both decided to do that.
Yeah, well, I mean, the thing is, because she passed away after our sophomore year, she knew that we were pre-med, that we were going to go to medical school, but she didn't know we were going to go to Harvard Med. Yeah. And, I remember just like, being there, meeting actually some of the deans that knew her, like that were the old school deans that knew her, and still also because they knew her, looked out for my sister and me. That was a nice feeling. It was like she was around, even though she wasn't physically around. And then, it was just, Harvard Med School was it was a very positive experience. Of course, I was always wondering, I would love to talk to her and compare experiences. Or I would love to ask her advice about like this clinical rotation I'm doing or this class that I'm taking. So, I think, I agree with you. Like when you lose your mother, the person that brought you into the world, it's truly like, I always say the rug was pulled from underneath me, and I've been trying to find my footing ever since. Yeah. And I know it's going to be, and literally, I know it's going to be a lifelong journey, because I was 19 years old. And even though at the time I didn't feel like a kid, I still, when I'm looking back, I was like, oh my goodness, you were a baby. You were a baby. Yeah. And so, so I'm so proud that we could be there for, be at Harvard Med, continuing our mother's legacy. But I think even more so, what I thought about and what I hadn't thought about before was that, my mother getting to Harvard Med in the 1970s, literally, she literally had to climb over so many barriers, just growing up in Brooklyn, on public assistance. She had, her mother was a single mother. She had 5 other siblings, and she just had to go through so much to get there. And so I think there's a piece of me that was always like, I wish that she could have had an opportunity to have like a little bit of an easier life. Like even later on in life, like she deserved that. Yeah.
Yeah. I hear that, because we think about how hard it is now, right? It's not easy to do that path. And then with everything that's happened societally, and the fact that people were not sort of as open, and I'll say that in quotation marks, to diversity being a thing. And I know that there's some rollbacks and pushbacks that are happening now. That must have been pretty challenging just generally. And I just feel like as a mother, and I know we both are parents, I just was beaming the whole time thinking about how she must have and still is proud. So, all right, talk to me about after Harvard Medical School, your career journey.
Yeah, so after Harvard Med, I was like, I got to come back to Brooklyn because I also wanted to be closer to my mom's spirit. There's just so much, so many memories I have of her, of us just growing up here, beautiful memories. And so after med school, I was like, I need that, especially during residency. So I trained in emergency medicine at Kings County, like you mentioned. And I knew residency was going to be hard. So I was like, let me just come back home to an environment that I am not only more familiar with, but that I feel at home, essentially. And I really enjoyed being able to train at Kings County, even though it was very challenging, because literally I would be on shift, and my attending physician and my senior resident were Black. And the patients, I mean, literally to care for the patients that seek care at Kings County, like that is such a privilege to care for them. They're so gracious. And so, yeah, I was there. I had a great time, but then I ended up burning out by the end of residency. I mean, this is what happens, right? You have a system that is broken, a broken healthcare system. Public hospitals, they're under-resourced. And, it started really getting to me into the point where I felt like I was becoming a different person. So I had to, just make some decisions. So I left. I did a fellowship in an emergency ultrasound at St. Luke's Roosevelt. And then I went on faculty for 10 years at NYU School of Medicine. And that's where I really had a lot of my, just a lot of revelations about how we are treated even within organizations, within institutions, despite having all of the accomplishments we have, right? It was really an eye-opening moment for me.
Wow. Yeah. Yeah. As the work that I do, I consult with organizations, professional development, and also around diversity, equity, inclusion across industry. But I'm a lawyer, so a lot of lawyers, and I see institutions over and over again having these well-credentialed Black women and Black men who continue to be subject to the bias, conscious and unconscious bias that happens because, well, because of all of the things, but that it just keeps getting perpetuated. And then you see people doing exactly what you talked about, burning out. And I find that in this country, particularly just given the fact that, we were founded on chattel slavery, that there is this expectation that Black women are going to continue to take until they burn out. And then it's like, okay, now you got 2 days to rest, get back up and keep going. And so hearing yourself and hearing that it was too much and then saying, I need to do something different, I think is profound. And it's a lesson that people need to sort of hear, right? Because we don't have to kill ourselves in order to do good work.
And that's why, even at the end of Legacy, in a call to action chapter, I had to make sure I had a special section for Black women. Like we are not here to save the world.
Yeah.
Yes, we're here to do meaningful work.
Yeah.
And the work that gives us purpose and that we enjoy. But we're not going to burn out for other people, for institutions, even our children.
Yep. That's a lesson. Double click on that one. It's so true, because I think about, just in my cohort of people who I know, folks who have gotten autoimmune diseases and stress-related things, all of these things that they were fine otherwise until having been in these environments that really your body starts to respond to these things.
Well, that's why, like in the book, I talk a little bit about the weathering, this phenomenon described by the public health researcher Arlene Geronimus, where she talks about how just dealing with the everyday racism, we internalize that chronic stress.
Yeah.
It leads to us developing chronic diseases, premature aging, and so I think it's so interesting because even though from the outside, I feel like Black people, Black women, we are so beautiful. Like, we always look younger than we actually are. But I always think about our insides. Yeah. And really, it's our insides, what you don't see, like are in a way sick, or not as healthy as they should be because of the racism that we have to endure.
Mm-hmm. Yep. Which, it's in so many different places. I feel like for me, my lens on what racism and bias and all the other isms, sexism, the intersections that they changed when I became a mother, because then it was me, but then it was me and my kids, and really thinking about, well, what if I don't change the world? What's going to happen to them? And so I felt like this additional weight of everything I do has to make the world better for them, because
of course,
and
I mean,
yeah, go ahead.
No. That's why I often think about Black folks having children, us bringing life into the world is an act of resistance. It is revolutionary in itself because we are making this conscious decision to bring Black life into this world, and especially in a country that doesn't love, appreciate, care for us, right? Yeah. But that's because we know that we want our children to experience joy, right? We want to make sure that happens. We want to make things better.
Yes. And I always think, I read a story when I was younger. It was something like, you may not be the one that's going to change the world, but the way you change the world is by creating the person who changes the world. And so I think about that in my children, and both of them, but in particular, my son is a cancer survivor. And so he had cancer when he was 1 year old. And the type of cancer that he had, 1 out of 4 children survives. And so I always think of him as the one, right? So what does that mean? And I remember my therapist being like, stop calling that boy the one. He's got enough pressure to think about it. But it's thinking about when we all show up and we live.
Yeah.
What's that blessing? What is going to impact the world? And we all have our little ways of doing it. I just know that my kids will have big ways of doing it because it is what it is. So let's talk about this. You then transitioned from academia to founding Advancing Health Equity. Why?
Well, because, I was plodding along in my academic career at NYU. Mm-hmm. I thought I was content, right? But I don't think I ever had really asked myself, Uché, are you really happy? Like, is this what you really want? Mm-hmm. I was doing what I thought I was supposed to do. Within medicine, if you have a career in academia, like that is like what a very small percentage of physicians have. It's considered prestigious. And I did love the environment. I found it very intellectually stimulating. But, I was doing a lot on my own. I wasn't getting a lot of mentorship. I wasn't getting a lot of sponsorship. And then I went up 7 years in, I went up for promotion from assistant to associate professor. I thought I had done everything I was supposed to do. I was told I had done everything. And my promotion got denied by the institutional promotion committee. And that was really an eye-opening moment for me, because I was like, okay, I thought I was doing everything I was supposed to do. It was like slap. I would say that was a slap that I needed, just to kind of shake me out of this kind of complacency where I thought that was the environment that I should be in. I thought that I was doing what I was supposed to be doing. And so then I questioned, I said, Uché, are you being valued? Are you being appreciated? And the answer was no. And then at the same time, I was also in a DI role at the medical school. Come to find out, it was just a figurehead role. They didn't really expect me to do anything. And so that was also incredibly demoralizing. So it was those moments that added up to me making this decision to say, doing work within, racial equity, health equity is so incredibly important to you, but these environments are not ready. Not only are they not ready for you, but they're not going to support you. They're not going to nourish you. You're not going to be able to thrive. And so I made this decision that a lot of people in academic medicine do not make, where I was like, you know what, I'm going to leave.
Yeah.
And I'm going to focus on on advancing health equity, my consulting firm, and I'll work part-time in urgent care to pay the bills. And that was my plan.
Scary, huh? Was it a little frightening for you to do that?
So scary. So scary. Yeah. So scary. I think I was in survival mode at the time, because I was also going through a divorce. So it was like all of these things were happening in parallel, where I was recognizing that I was like in this little box. I was actually making myself small.
Yeah.
And I was like, oh no, I can't do this anymore.
What do you think that the pandemic, how did that accelerate or make more focused that decision? Because I remember following you on social that whole time, and you were a source where we were like, okay, what did she say to do? Wear a mask? Okay, good.
Yeah.
All those things.
Right. Thank you.
Yeah.
And I think it was interesting because once I left NYU, that was December 2019, and then January, February, I was like, okay, this is really nice. This is so chill. But then, you know what? Then March happened. And what I always say about March 2020, being in New York City, as you know, is that like I stayed the course during a time that the waters were very rough. And staying the course meant that I kept and continued to do the work that I thought was important for us and for our communities. So I started writing about what I was seeing in my urgent care practice. So I became one of the first voices to call the alarm about racial health inequities. And then I became that person. And then I also felt the urgency to make sure, because of what was happening in our government, that to make sure that we were giving out information that was accurate and responsible, especially to Black communities. And so I felt immensely like, even though I was going through all this personal turmoil with my divorce and then this career transition, that I actually found purpose. I found purpose, even more purpose in my work. And I feel like the pandemic has still accelerated that. Unfortunately, Miss Breonna Taylor and Mr. George Floyd's murders accelerated that too. Like, even though I started the company in 2019, like the work became even more needed.
I mean, I had a memory of at one point you talked about, navigating your kids and masks and being outside. And I was like, okay, whatever she says, I remember like screenshotting it and being like, listen, everybody. But that, when I think about your brand, it's important. Trust is a huge part of branding, right? Like, so for people to think that you are someone who I don't know, but I know and feel as if I can trust what you're saying, that in a time when there was so much turmoil and so much places where you're like, can I trust that? I'm not sure. And I have these kids and my husband, my family to take care of. Having you there was really like this, like calm in a storm that was really wild. And so,
thank you.
It just came back to me. So I want to thank you, because
I appreciate that.
A wild time for everyone. I know people are going to be like, girl, yes, all of us, but particularly thinking and realizing that it was impacting Black people in a much more devastating way.
Yeah.
That was really scary. I remember that summer, we used to go to a ranch upstate every summer, and the folks were like, oh, we're still going to have the ranch. And I was like, but we're Black. I was like, we can't go, because, you could be all loosey-goosey, but we cannot be loosey-goosey, because I don't know what it's going to be. Yes. Oh, okay. So you kind of gotten into this a bit, but I want to ask specifically, what were some of the most challenging barriers that you've had to encounter while trying to implement change in the healthcare system?
I think, for us, like the work that we do is just so deeply personal, right?
Yeah.
And I think sometimes it's hard. My emotions, my feelings, all they get involved in this work.
Yeah.
It's not, and even, my consulting firm, it's not just a business. I was just talking to one of our team members the other day. Like, for me, this is about building relationships with organizations, with communities. Like, it's so important. So when there are companies or client organizations that just want to check off the boxes, that don't actually want to put in the time, effort, and resources, like, that is very, very frustrating to me. I think the other thing that's frustrating is that, despite significant advances in technology, innovation, research, we're seeing of racial health inequities. We still see worsening of Black maternal mortality rate, Black suicide rate. I mean, and it feels sometimes like it's like we're the only ones that are very troubled and upset by this. And it's like, how do you can't really teach people empathy. I feel like either you have it or you don't. I feel like when it comes to Black folks in our communities, people have an empathy gap with us. And so I think for me, it's like, how do I, and that was part of writing the book, like, how do I communicate to healthcare systems, hospitals, policymakers, white health professionals, that this current situation is unacceptable. It's unconscionable. Like, y'all should be embarrassed that in this, this high income country that we have Black people living with such poor health, not because of anything that we've done, but because of how our systems work.
Yeah. Oh, you took my breath away when you said you can't teach empathy. It's so true in that the pandemic, I think, put a highlight on the fact that no matter what we think, we are all interconnected, right? And the experience of all of us are interconnected. So regardless if you don't on your face care about another group, it still impacts you. I remember having a conversation with someone who was like frustrated because his childcare person would not come. And I was like, she has kids, like, and only thinking about his situation. And I thought to myself, of course she's afraid, because whatever she does with you, she has to bring back home to her children. But the empathy wasn't there. And I recall having the conversation to say to him, let's think about what might be on her mind. Let's think about why it might be challenging, so we can kind of get in that space. But even still, it's devastating. As I read a Times article recently about the Black maternal health, and it's just like, I have been so blessed to have wonderful doctors across the spectrum, all races and all genders, who have cared for me. But I also know that I'm a lawyer and I know how to advocate, right? And I think about the people who don't have the voice or the knowledge, right? Or who are fearful of speaking up, and the experiences. And remember when Serena Williams, when she had her health, and then Beyonce, those things shone a light on it, that then people started to care a little bit more. But even then it was like, oh, right, Black women. And when you look at the society, Black women are a core piece of how our society is able to thrive. It from back then and still to now. And when I was, reading your book, it came to me. It was like, you told a lot of stories. You told a story about somebody with sickle cell, and I saw about all these things that impact us that folks think that's them, but them, we all interconnected, right?
Yep.
Yeah. Yes. So, all right, tell me, what inspired you? What was the catalyst for writing Legacy?
So it's interesting because, I have to be honest with you, writing a book was not something I ever had truly thought about. Mm-hmm. But I always say that writing Legacy happened because I was doing the work that I was supposed to be doing. My literary agent, my book agent, she heard me on the radio in the summer of 2020 on the Brian Lehrer show, on WNYC. And she cold emailed me and was like, oh, I follow you on social. I just heard you on the radio. She said, I think you have a story to tell, and you're the only person to tell that story. Okay. And we talked, we hit it off, and I told her like my vision for the book. I was just like, okay, if I had to do a book, this is what I would do. Use my mother's experiences, my experiences to talk about these larger systemic issues and racism in medicine. She's like, that sounds great. And so while it wasn't something that I was like working towards, I realized it was somewhat, consciously, it really was something I was always working towards, because I think telling our stories is so very important. Mm-hmm. It validates and affirms the experiences that we have. And the fact that I have experiences as a Black woman, as a Black patient, as a Black physician, to have both those inside and outside experiences, I think it gave me a unique perspective to share in this book.
Yeah, it's so very well done. And I am a judger of audiobooks. Like because after law school, I don't want to read a book again. I want to just listen to it. But I got the book and I listened to it at the same time to sort of navigate my ADHD. But the telling of the story, and I know they sometimes say like your first book should let people invest in you and then what you care about. And it's exactly that. It's exactly that, where I was like, of course, where I felt like, like a cousin from over there that was like, we're the Blackstocks, even though I'm, it just was an investment there.
People have told me that. I was just at a conference. So someone said, oh, I feel like I know you because I listened to your audiobook and you were telling your story. Yeah. And I loved recording the audiobook. It was such a wonderful experience.
Yeah, no, it is great. Again, I judge them because when you feel the emotion, you speak the emotion. Like it's not just I'm reading the words. And So everybody, we'll put the link in the show notes, but make sure you do all of the above, get the book and the audiobook.
Thank you.
Of course. So we kind of got into this a little bit because you talked about the fact that this is not just work for you. A big part of personal branding is showing authenticity and vulnerability. Do you think that that vulnerability piece makes you a better practitioner, a better person that does what you do? And how do you navigate that as a Black woman?
Yeah. No, I know. No, I mean, I think it's kind of how I am, just my personality. When I meet people, I'm very much about connecting with people, like on a very personal, like even emotional level. Like I will share things, but there's a difference between doing that one-on-one versus doing that when you have like a larger platform, and so definitely there are things that like I don't necessarily share now on my social media that I used to maybe like 4 or 5 years ago. So I think definitely as Black women, we always have to think about protecting ourselves. Yes. Always, because we are so exposed, because we are often so much without protection. But at the same time, I do think that vulnerability is what allows people to connect with you and, to connect with me, right? So you have to, so even like, writing the book, there were a lot of things that I shared that's my story, my family's story. And I remember when the book was about to come out, like a few days before, it wasn't as if I had not thought about it, but I said, oh my goodness, all my business is going to be out there, But of course, it's a memoir, so not everything is in there, but a lot was in there that's very dear and personal to me. But I think that is what moved people, what resonated with people who read the book. And that kind of also storytelling, sharing, relating, I think helps people to understand even the larger issues that I talk about in the book.
Yeah, I agree. As the people, I agree with that 100%. It makes, came out of hearing it, thinking to myself, this is going to change so many people's lives because, and I want everybody to hear it. I don't want you to just read it because you're like interested in medicine. I want you to read it because there is something that you need to hear in this book. We need to understand our own experiences. Should you be a woman of color, Black person, et cetera. But also, if you're not, you need to hear what is happening and what the issues that you're elevating, because it impacts all of us.
Yeah, absolutely. And it's interesting because I was just talking to my publisher about when the paperback comes out next year, they want to pitch it for the first year experience to actually to universities to read, like for students to read during freshman year. And I was really excited about that because I always say that I wrote the book for a broad audience. I wrote it for everyone will get something out of it, but it's also the book that I wish I read when I was younger. Because it would have given me just a different perspective of what health looks like. And that health is not even just our healthcare system. Health is what everything that happens in society, and how it impacts us, impacts Black folks disproportionately. But it's something that everyone needs to know about.
Yeah, no, 100%. And when I was reading, I was thinking about the doctors that I have had, and I've had some health issues over the years. And I remember there was this one doctor. He was a rheumatologist, and he was dogged. He was like, I have to figure out what's wrong. And the fact that he was so invested, I remember he called me on a Sunday and was like, go tomorrow to go get a test because I think this might be it. And I remember feeling so loved. And it's not an experience that a lot of people have when you think of healthcare. And this was a white man who was just like, we're going to figure this out. And
he was still.
And you talk about, there is a phrase that you have called, oh my gosh, I wrote it down and I forgot. I put it on my notes. It's a type of approach to healthcare. What is it? I'm
culturally responsive, sexually competent.
Yes. I thought he was like the epitome of that, in that, he was asking me questions about like stress that I had and what about my family and things. I was like, how did you know this? Like, how did you even know to ask these questions? And that was one of the things I thought, gosh, when people take this out of here to understand that that is a way in which their experience can be. And those first years that you're talking about, that's the way that they can be in terms of providing this, that's going to change the world.
Yes, I know. That's why I'm like, oh, please, universities, buy this book for your students. Have your students read it, because the earlier that they read this book, the more that they will be informed, right?
Yes, agreed. Also, a great graduation present for folks who are pre-med and thinking, like, I just thinking about wanting to get yourself prepared and thinking about what type of physician you're going to be. I think it just makes total sense. Okay. So you talked about your call to action. You talked about what you wanted folks to do. What are some 2 or 3 things that you think when people read the book, what do you want them to do? How do you want them to do different based on having read the book?
Yeah, I think one thing I would love for people to do, because I know sometimes after they read the book, it feels so overwhelming. I would love for them to look closer to where they are, hyper local or locally, because many of the solutions are in our communities. Like Black-led community-based organizations have a lot of the solutions to our healthcare problems. So like I talk about in the book, the birthing center that's in Minneapolis that a Black midwife founded. There's so many very similar programs, even other health related, that make a difference in our community. And so thinking about how we can support those programs. The other thing is also thinking about, how can we inform our policymakers, whether it's local, state, federal, about what we need to be healthy. And when it comes to Black communities, that's all about investing in Black communities, investing in every aspect, not just making sure that we have access to culturally responsive healthcare, but making sure that we have gainful employment, making sure that our schools are funded. So I want us to have a broader sense of what health looks like, making sure we have paid family leave and sick leave, universal healthcare. All of that is so important. And so those are the kind of policies that we should be advocating for as communities.
Yeah, no, I love that. And I think on a personal, individual level, I want everybody to read the book and then tell somebody else about what they read and suggest that they read it. Because to the point of having trusted advisors, right? I thought of you as a trusted advisor and, without knowing you, but we have this individual connections with folks in our communities and we're influencers in our communities. If we can share with others what we have learned, we make a difference in wonderful ways. And speaking of which, I want to give a shout out to Harlem Acupuncture because it's run by a Black woman and an Asian woman, and they are doing God's work there by bringing the stuff from the East to meet with the West. In terms of
I have to check that out.
Yes, you do. They're fantastic. Really a great part of my healthcare journey and a lot of others that I know as well. All right, so we talked about the call to action. We talked about all these things. Everybody's going to go buy the book. They already know that's in the checklist. I need to know, Dr. Blackstock, what do you do for fun?
What do I do for fun? Okay, I know. Everyone's always like, are you taking care of yourself? Okay, I love to get together with my girlfriends. I love to go for dinner. I love live shows. Like I love live hip hop shows, festivals. And of course, like spending time with my kids is always fun. But I love my girlfriend time, and I also love to travel. So sometimes I'll travel by myself. Sometimes I'll travel on a girls' trip. But I really enjoy just having that time to connect with my girlfriends because it makes me remember that, even though I hold all of these roles in my life, that really the one that's dearest to me is the one I hold with myself.
Oh, I love that. I recently did a panel for an organization I'm involved in called My Sister's Keeper, My Brother's Keeper. And we did a panel on our healthcare journeys, and it was me and 2 of my best friends talking about how we supported each other through our healthcare journeys. And it was powerful. I had to bring my own box of Kleenex with me, but it was so powerful. And I thought about our conversation that we were going to have, because it was 2 weeks ago. And I thought about the fact that if people understood that having a crew, people who you can rely on, is a part of your healthcare journey that you can tell and get recommendations for and share, it just helps with navigating. Sometimes you feel like everything is on your shoulder. And if you get to be using your crew in that way, and your therapist, y'all all know I talk about my therapist.
I was actually going to say yes. And my therapist, my therapist has held me down for the last 5 years through personal, professional transitions. The day that my book came out, she sent me the most beautiful flowers with the most thoughtful card. The card, I actually put it's on my mirror. I read it every day.
I love that. Do you feel like it's like getting an A from your teacher when your therapist says something?
Yes. Yeah. She said, I'm so proud of you. I'm so proud of you.
Yes. When my therapist tells me I'm grown, I'm like, I've grown.
Yes. I know. It's about you're like, yay.
Yes.
I did it.
Good. And all of you now know that, well, I say it all the time, but it's your health piece does not fit unless you're actually thinking about your mental health as well. You have to think about all of them.
Absolutely. Oh, yes.
All right.
Yes.
So we talked about the fun. Everybody in my show gets asked the same two questions. First one is this. What is this? I call it the stand by your brand. What is the authentic aspect of your personal brand that you will never, ever compromise on?
Can I say my integrity? Can I say integrity or no?
Of course. It's your answer.
Okay,
yes.
I'll say my integrity because I try to be really thoughtful about what I say yes to. Mm-hmm. What I align myself with, what organizations, what kind of work, what people. I'm very extra thoughtful about that.
Mm-hmm. I mean, which is a brand proposition, right? Because a big part of your brand is who you align with. And so I actually love that you pull that out there because we haven't necessarily talked about that as much. Who you say yes to and who you say no to is a big part of your brand. And so I'm really glad that you pulled that out. That is a takeaway.
Yeah. I mean, when I used to be on air a lot, I would tell my agent, like, there's certain networks I'm not going on. Mm-hmm. If they ask for me, just tell them no.
That's not going to work for us. Thanks so much. Love that. All right. So tell me this. Branding room only is a playoff of the term standing room only because I'm clever. And so I want you to talk to me about what you think is that aspect of you that would have people in a room, only standing room, to experience about you.
Yes. Oh, I think I just have a great way of connecting with people. That's why one reason why I love public speaking and traveling and meeting with different groups to talk about my book, not just my book but all the work that I do, because I'm able to talk about it and communicate about it in a way that really resonates with people, that, makes them recall something in their childhood or something they've been through, but it makes us connect with each other. So literally after every time I give a talk, people literally this line's so long, people just want to talk to me. Mm-hmm. And I think it's because I see them, they see me, and we connect on a deeper level. And I think that's just something that I was born with, that ability to connect with people.
I want to pull that out for a minute because so often people will maybe make an answer just like that and not attribute it to the fact that it's just their magic. And that's exactly what it's your magic. There are people who can make standing room and to talk about things that is their expertise, but the how you make you feel part is your magic. And I'm really glad that you pulled that out because I agree with you. And I want to thank you for sharing your magic and for saying yes to this conversation and for doing the work that you do, which is so needed. Everybody is going to go out and buy this book. And I really hope that this conversation will resonate in so many other places that maybe you haven't touched, so that it will broaden the reach of your impact, which has been so, so, so impactful. Thank you, Dr. Blackstock. I really appreciate you being on Branding Room.
Oh my gosh. Thank you so much, Paula. I had such a wonderful time. This was a very fun conversation.
Agreed. All right. Thank you so much for tuning in to another wonderful episode of Branding Room Only. It was such a pleasure to have Dr. Uché Blackstock with us today. She shared such a profound story about her experiences and the impact of having a brand that really resonates and represents one's values and aspirations. Remember that your brand is your story, and it's the power of the story that can change lives. And that's what Dr. Blackstock has done and is doing. Don't forget to follow us on your favorite podcast platform, rate us highly, and share this episode with others who might find it impactful. P.S. That's everyone. Join us next time as we continue to explore the depths of personal branding with more incredible guests. And for now, stand by your brand, y'all. See you soon. Bye.